bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're talking about cancer treatment, how to get better treatment, how to live longer. We've talked about how to give you 3 more years of life today. I want to talk about what happens when you have lousy follow-up, okay? People sometimes just go anywhere and get a test, and they think it's all the same. It's not all the same. So let's give an example. So this patient came in, a man with pancreas cancer and liver metastasis. He came to me in March this year. So in March he had a pancreas cancer, liver metastasis. He was being treated in a neighboring state, and there he was getting chemo. It wasn't working. Came to us. I gave him the data, just like I gave all of you, our success rate, or ability to stop a cancer in the pancreas or liver. Where we aim the beam is 90%. He wanted to go with us, and he went with us, and in March he was treated. 5 treatments to the pancreas, 5 to the liver. He did great, no side effects. And now he was going to another doctor, and he came to me and he said, "Doc, my cancer's growing in the liver. My doctor wants to change treatment." I said, "Well, how does he know that?" And he said, "Well, I had a scan." I said, "Well, where's the report of the scan?" He said, "Well, I don't have it." So what do? We chase down the scan, because that's what we do, because here's a patient believing that the treatment didn't work, and we find out that this other facility compared CAT scan from December 12th, 2013 until July 18th and said the cancer traveled. But I told him, in December you weren't with me, in January you weren't with me, in February you weren't with me, in March you came to me and just started treatment. So they're comparing 4 months before the treatment. What if we compare the scan when you were here in March to today? Isn't that more fair? Because he wants to know if the treatment worked or not. We know, of course, the cancer grew before he came to us because he was getting chemo. The chemo wasn't working. So we had the scans from the day he came to us till now evaluated, and guess what? The cancer's in remission. The cancer is stopped. So just because you get a scan doesn't necessarily mean that scan's correct. If they compare the wrong dates before we even got to him, and then he allowed the cancer to grow in December, January, February, March, and only then did we treat him till now. It's not fair. You want to start a race at the same point. And we start the race at the same point. He heard, yes, in fact, radiosurgery is working. The cancer is stopped. There has been no growth. And that's the correct answer. So it's very important where you go, how the test is done, that the radiologist understand when the treatment started, where it was treated, and what are the results from that. So he came to me miserable last week, and within a day or two we were able to tell him from Monday to Wednesday, got all the scans, got them read, got them compared, got a report in his hand showing, yes, radiosurgery worked. The cancer that we treated in the pancreas and the liver has stopped. There were multiple treatments, 5 to the liver, 5 to the pancreas, and there were multiple spots in the liver. All the spots of cancer stopped. And that shows you the power of radiosurgery when chemo didn't work. So this man went from being miserable, sad, unhappy, to content that his treatment's working. What a difference a day makes. Wow, what a difference a day makes for that man with stage 4 pancreas cancer, now actually in remission. With another man who came to us with a Gleason 7 PSA 5.76 prostate cancer. He saw the data, he saw our results, 90%. He looked at the booklet which we gave him, and he chose to go with us, which I think is the right thing. We have another man who I just spoke to yesterday. He called me up because he says his hair is falling out. Well, that should be the worst thing that happens to someone with a Gleason 7 prostate cancer. He came to us last October. He was going to go elsewhere for different treatment that had a low chance of success. We showed him the data for our results, Gleason 7 versus other hospitals, and he went from about a 30% success rate to a 90% success rate using treatment in the stereotactic frame and brachytherapy. He's already had a follow-up which shows that his PSA has dropped by about 2/3. He's doing great. He's intact. Yeah, he's worried about some hair falling out, but many of us are worried about a hair falling out, but I'd rather have that worry for the next 50 years than not being alive, obviously. And here's another woman who came to us with a kidney cancer, a 70-year-old Hispanic woman. She was fine. She developed urine with blood in it 2 years ago. She was eventually found to have kidney cancer. The CT was done last year. She had a biopsy last year. Then no treatment. So obviously the cancer's been growing. So she had kidney cancer, found because of blood in the urine, worked up, biopsy positive, and went elsewhere where they were planning to do removal of the kidney, like another patient I spoke about earlier in the hour. She is now coming with us for stereotactic radiosurgery for cancer in the kidney, nowhere else, and she's looking at our known success rate of 90%. We're not perfect, but we're pretty high. We had another man come in this week from Italy with stage 4 pancreas cancer. We treated him a year and a half ago with stage 4 cancer. It was in the pancreas and it spread to lymph nodes. We treated both the pancreas and the lymph nodes, 5 treatments each, and he remains in remission. He's happy, he's functional, he's an architect in Italy. He's an Italian stallion. He's about 70 years old with a 30-year-old girlfriend. Yeah, he's an Italian stallion in remission, thank God, to a large degree, I believe, because of the radiosurgery. And another man, an Hispanic man with gastric cancer and liver metastasis. He was sent to me by the surgeon who tried to remove the gastric cancer. The gastric cancer was inoperable, stage 4. We treated both the gastric cancer a year and a half ago and the liver. Stage 4 gastric cancer. He walked in this week. He looks like a different man, and he is, because he's in complete remission. He had gastric cancer, stage 4. We treated the stomach. We treated the liver. No other treatment in the liver. The cancer went completely away. He's doing great, feeling fine. We sent him for a PET scan just to make sure everything is fine, and hopefully he's in great shape, will remain so in remission. We'll report back to you about him. It's a great show. We'll be back at 9 o'clock tonight on WOR, the same station. If you have questions, medical questions during the day, please call us at 212-CHOICES, which is 212-246-4237. Our office is at 1384 Broadway. We know there's 50 million visitors a year in Times Square, so if you're in the Times Square or Herald Square, Penn Station area, and you want to pick up all our booklets, we have multiple booklets on brain tumors, brain cancers. We treat acoustic neuromas, pituitary tumors, meningiomas, which are benign tumors, and also brain cancers, cancers of the body, and prostate. There's unique booklets for each. They're available at no charge. So again, it's Dr. Lederman. Thank you for listening. I hope you enjoyed the show. Hope you learned a lot. Now it's time for your 5-minute run. So have a great weekend. God bless you, and talk again tonight. Thank you.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 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 212-CHOICES.